It has taken Faye Wadhams and her doctors nearly 4 years to get her medication for her epilepsy correct. So it was with some concern when she heard the government suddenly announce that pharmacists could swap drugs prescribed by a doctor if there is a shortage.
You can't just play with medication. It's not as simple as taking a paracetamol for a headache.
The serious shortage protocols became law in January, but when the charity SUDEP Action complained to the Department of Health and Social Care, they were told epilepsy would now be exempt. Neither they nor Faye Wadhams are reassured.
If you start messing about with my medication, you take away my ability to work, my ability to look after my child. It impacts my family. You can't just play about with medication. It's not as simple as swapping one pill for another.
Now the department is facing a judicial review with claims the government had failed to consult on this legislation. Today they said the introduction of strict protocols is a sensible step which will, in exceptional circumstances, allow highly trained pharmacists to provide an appropriate alternative. Patients will not be given alternative medicines where it is not medically appropriate. But the action is being backed by a number of charities, including those supporting HIV/AIDS, who say it is vital that a doctor remains in control of the medication.
Healthcare professionals do not agree with government that these measures are satisfactory. They have profound concerns. Some of them are terrified about what the use of serious shortage protocols will mean for patient safety. They are concerned about whether patients will get the drugs they need. They're concerned about what it means if drugs are substituted. So if you've always used drug X, what will it mean if all of a sudden drug X runs out and you're forced to go on drug Y? What does it mean if you're a patient who's used to getting 100 milligrams, but the pharmacist hasn't got enough to give you 100 milligrams and so starts giving you 50 milligrams or 20 milligrams?
Already fears have been expressed over supplies of insulin for diabetes in the event of a no deal. In response to a letter sent to the MP Dawn Butler, she is told the department is working with partners across government in the health sector and in industry to prepare for any possible disruption in the supply chain. And it goes on to say it is working to guarantee sufficient freight capacity to maintain supplies. Diabetes UK issued a statement at the end of February demanding concrete detail from the government on access to insulin in the event of a no-deal Brexit. Very quickly, the charity was called in to see government officials, and now they say that they are happy with those plans, although they haven't told us what those plans are precisely. And what other charities and the Good Law Project, which is seeking this judicial review, are concerned about is that the government has not provided a list of other medicines which could be affected by a no deal. In fact, the Health and Social Care Committee also asked for that list, and the government said it was subject to commercial confidentiality. In January, Channel 4 News reported on the transportation of radioisotopes from Europe to the UK and fears of any delays because they only have a 3-day shelf life. 3/4 of medicines come to the UK from or via Europe. The government has said contracts have been signed with 2 ferry companies for the next 6 months and that medicines will have priority. And they have asked drug companies to stockpile at least 12 weeks' worth of medicines to act as a buffer in the event of a no deal.
England's struggling towns are to be targeted with a £1.6 billion government fund. It's been branded a bribe by the Labour leadership, designed to win over Labour MPs thinking of backing Theresa May's Brexit deal. But it's money that will be spread over up to 7 years, and it seemed to drive some Labour MPs in the opposite direction.
There had been an expectation when the government said that they were going to do something very positive for our towns, that there would be this game changer that would enable us to get that infrastructure rebuilt and get those good jobs back after several decades.
You think it could actually drive some votes the other way?
I think it's been so badly handled, this whole episode, that it's possible that Theresa May has lost even more trust than she had before.
I think that actually what she's done is for the first time acknowledged that there are left behind communities, but then said, you know what, you may be left behind, but here's a couple of million and off you go. That isn't going to make up for what this government has savaged to my community.
The Prime Minister, visiting Salisbury today on the first anniversary of the Novichok attacks, had been hoping today's announcement of extra money might get a warmer response and dislodge a few dozen Labour MPs from the other side to help her deal through the Commons.
20 to 30 is a reasonable number. There are more than that considering it. I'm sure pressures will be put on them by the whips and others.
She'd be lucky if she got 15 Labour MPs walking through that division lobby with the deal that is currently on offer. And I suspect that number might even be a bit smaller following this announcement.
Meanwhile, on her own side, Theresa May is trying to win over the 118 Tory MPs who voted against her deal in January. The Attorney General, Geoffrey Cox, returns to Brussels tomorrow, trying to extract legal commitments which will allow him to change his legal opinion on whether the backstop is truly temporary. The pro-Brexit ERG group of MPs has meanwhile set up a council of lawyers who will judge whether his new legal position passes their tests. Today, the Daily Telegraph reported that Geoffrey Cox had dropped his demands for a hard limit or end date for the backstop. The Attorney General tweeted that was misunderstood fag ends dressed up as facts. Sources in the ERG say nothing less than a protocol confirming a route out of the backstop will satisfy the vast bulk of Tory MPs who follow their grouping. Though a few have signalled that their bar is a bit lower than that, and they're pretty much ready now to switch sides. Some people in the ERG are going to take a very tough line with whatever Geoffrey Cox comes back with.
Indeed.
You're going to bend a little bit more because you're just so terrified of a delay, you don't want to go there.
Precisely. Yeah, I mean, say, the date of the 29th of March is what I will work. All my votes will be driven by the determination that we honour that commitment.
Having voted against the deal first time round, you've been on a bit of a journey, but it's not a conversion.
No, it's certainly not a conversion, but an acceptance of reality.
The investment fund announcement for English towns landed badly with quite a few Tory MPs, concerned that the Prime Minister's team was targeting Labour areas and Commons Labour votes, overlooking poorer wards in the Tory seats.